Hi, this is John Schumacher, physicaltherapyguru.com, showing you guys a common low back pain strategy, an examination and self-treatment strategy that works very well, that I've taught several of my patients over the years, especially for folks with low back pain that tends to be on the left side, either low back or buttock pain on the left side. So the first thing you're going to do is you're going to turn to the side here, is you're going to test a march. So what you're going to do is raise up your legs as high as you can, like you're marching in place, and pay close attention to the ease at which you can raise your legs up in the air. Often you'll feel on the painful side, if we're doing the left side, which is usually the most common side for this, it'll be stiff or a little bit more difficult to lift than the right leg. And pay close attention to it, because it can be somewhat subtle, but you'll often feel, yeah, that just doesn't go up as high as the other side. Definitely tight, definitely a little bit limited compared to the other side. So what that is usually is there's often a small underlying spasm or a hypertonicity in the glute muscle on that left side. So that's what the test tests for. Let me get into the treatments for you. So thank you very much. Hi, this is John Schumacher, showing you guys the first exercise in the series. What we're going to do is we're going to need a foam roller. These things are fairly inexpensive, $25. You can get them at Big Five or Walmart or whatever is close to you. They're a great tool to have for your body. So what we're going to do, we're going to be working on our left side again, as we remember. So go ahead and we're going to have this on the ground. What I'm going to do is go ahead and sit my left buttock hip area on the foam roller. And what I'm going to do here, if possible, bring my leg up here on the opposite leg. And I'm going to be unloading myself with my hands a little bit. Don't put all of your weight on it. It will get a bit discomforting. And what we're doing is we're rolling ourselves along here until we find the spot that is significantly tender. And what we're going to do is we're going to be holding over that spot for, say, a minute or two. You want a long duration compression on the buttock muscle. You're basically trying to get the muscle to let go. The problem often with low back pain is that there's just too much tension in the buttock area. So we want to get that area to just basically let go. So I'm going to sit here, hold this for a couple minutes, and then I'll see you in the next video. Hi, this is John Schumacher, showing you guys the second exercise in the series. We've already done the foam roller to the left buttock muscle. And now after doing that, after inhibiting the buttock muscle, the gluteus maximus, we're going to be doing a stretch after that. So after you inhibit a muscle with a lot of tension in it or hypertonicity, then we want to lengthen it and further get it to let go. So what I have my patients do next is have them, I'll show you over here, we're going to lie down on our backs here, and we're going to give it a good stretch. So we're going to be stretching the left side. The left ankle goes just above the right knee, and we're going to bring our leg up a little bit like that. And what we're going to be doing, that creates a space between here a little bit that I'm going to be using my hands and reaching through and grabbing the opposite, the right leg here. And we're going to pull that up until we feel a decent stretch in the left side of our butt here. Usually I'll have them hold for, maybe at least 30 seconds to a minute. We want a good long hold. Don't bounce, don't jerk the leg. Try to hold it very steady as we stretch here. If we bounce and jerk around our leg too much, we'll set off a stretch reflex, which will do the opposite of what we're looking to do. So make sure you're able to hold it steady for a good amount of time. If that one isn't too bad, what I'll do, I'm going to turn around here and get down into here. If tolerated, if it's not too uncomfortable and you need a larger stretch, we can do this one where I tuck my leg under my body with my foot on the inside, and I sort of lay down straight over my hip here to stretch the left buttock muscle. And again, a long hold, 30 to 60 seconds. Try not to bounce, try not to move too much, just try to let your body relax into that stretch. So those are the two stretches I usually use after I use the foam roller technique. I think they go together great. Hi, this is John Schumacher showing you the third exercise in the series for low back pain. So what we're doing, we've done the foam roll to the left buttock. We've done the stretching of the glute and piriformis muscles. And the third one, after doing that, we then want to facilitate those muscles. So one of the easiest, safest, least painful ways, if you're having some back pain, to do it often is to do the bridge. So what we'll do, we're going to lay down on the ground or on a mat, like so. It's a very common exercise, but it does a great job of facilitating the muscles now that we've helped them release. So what we're going to do, we're going to tighten our lower abdominals. We're going to squeeze our buttock muscles together. We're going to hold those positions, and then we're going to push through our legs, not arching our back, push through our legs to lift our bottom up, keeping our buttock muscles engaged, keeping our lower abdominal engaged, and holding for about 6 counts. It's often helpful to raise the toes a little bit, putting the weight on the heels to transfer some of the weight more into the buttock area. So we're going to come down, tighten our lower abdominals, squeeze our buttocks together, lift up through the heels, push through the legs, don't arch your back too much. Hold for about 6 counts, and back down. We're going to repeat that about 8 to 12 times, one set. After doing that, that's the completion of our self-treatment series, and I'll see you at the next video at the conclusion. So here we are at the conclusion of our series. We've done the foam roller to the left buttock muscle. We've done our stretching for the low back and the buttock area, and we've also done the bridge exercise to facilitate and help get the normal tension into that area. So after doing those 3 exercises, what we're going to do is we're going to recheck our march again. So again, the march is done by lifting the knees up as high as possible, and if it was successful for you, you should feel an increased ease in lifting up the leg that was previously tight. What that tells us is that there was definitely a spasm in the gluteal area, and what that spasm will do is actually rotate your hip a little bit, your pelvic girdle, and hold it in a bad position, thus causing back pain and gluteal pain. So hopefully it was helpful for you. I hope it worked for you. Please leave me a comment and let me know how it worked for you, and have a great day.